Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in Fort Myers. I'd like to talk a little bit about some of the main points in regard to Ehlers-Danlos syndrome and as it relates to ligament laxity and prolotherapy. Ehlers-Danlos syndrome, at least a lot of the pain and other things that are related to the pain are actually caused by joint instability from ligament laxity. So I look at Ehlers-Danlos syndrome as a genetic, progressive, destructive ligament problem. In 99% of EDS patients, the ligaments have normal genetics, meaning that Ehlers-Danlos syndrome is a problem often with type 3 and type 5 collagen. So it's actually the type 1 collagen that gives the strength to the ligaments. When you have a genetic mutation of type 1 collagen, that condition is called osteogenesis imperfecta. Now, it is true that 5 to 9% of ligaments are made up of type 3 collagen, which can be defective in Ehlers-Danlos syndrome. But what gives the strength to the ligaments that hold the joints together is actually the type 1 collagen. And genetically, Ehlers-Danlos syndrome patients have normal genetics as it relates to type 1 collagen. So that's why they actually heal really, really good with prolotherapy. In EDS, the ligaments are tall and lanky, which leads to joint instability. Prolotherapy causes ligaments to be short and stocky, so prolotherapy can cure the joint instability of Ehlers-Danlos syndrome. And that's basically it in a nutshell. We all know that people with Ehlers-Danlos syndrome actually don't respond really good to orthopedic surgery. Like, I had one Ehlers-Danlos patient that had already had 14 orthopedic surgeries on one joint. I could just tell you story after story. Another patient, after her 7th surgery on her shoulder, she came to see me. The thing is that the more loose jointed a person is, the more orthopedic surgery stabilization procedures don't work good. So if you have joint looseness all over your body, you're much better off using prolotherapy. Prolotherapy works extremely well to tighten the ligament. So the ligament tightens a little bit, then you get another treatment, tightens it a little bit, another treatment, tightens it a little bit. So you're basically controlling, if you will, the amount of tightening that occurs, and there's a whole process with that. Prolotherapy is a series of treatments. And again, depending on the case, I definitely have patients that come in for 1 day, other patients come in for 2 days, other patients come in for 3 days because it's so many joints to be done. You actually can get all the joints of the body tightened with prolotherapy if you have Ehlers-Danlos syndrome. So I hope this explains why people with Ehlers-Danlos syndrome respond so good to prolotherapy. And if you've been diagnosed with loose jointedness, joint hypermobility syndrome, benign congenital hypermobility spectrum, or Ehlers-Danlos syndrome, please consider getting an evaluation by a doctor who's proficient at and experienced in prolotherapy.